I'm Alex Reese reporting live from Washington, D.C. Now let's go live to Liz Kodalik in downtown Phoenix with more. Liz?
Alex, if the Affordable Care Act is deemed constitutional, there are many who fear that the seemingly small amount of primary care doctors in Arizona, as well as the nation, will not be able to handle this huge influx of new patients. However, I spoke to some in the medical field today, and they told me that they felt differently. Christian Demeff and Jeff Tooley enrolled in the University of Arizona's medical school because they love the field. Christian plans on becoming an emergency room doctor, Jeff a primary care physician, meeting a heavily publicized need for more in the field.
The looming physician shortage we've all been told about.
Statistics like this one and this one have many concerned. And the enactment of the Affordable Care Act could mean another 1.2 million additional Arizonans trying to make appointments with their doctors. Despite the hype, Jeff suspects residents will get the care that they deserve.
I'm not seeing more people get interested in primary care, but I'm seeing about, a half and half mix between the specialists and the people going into primary care.
John Ford with the St. Luke's Health Initiative thinks the hype about the effects of so-called Obamacare on primary care doctors is exaggerated.
We have had an issue with the supply of physicians in this state for the better part of 10 years, but I expect that in the road leading up to 2014, both the supply side and the demand side will figure out how to handle it.
Ford says programs like Arizona's encourage students to stay in state, and more than half of those graduating in May are completing their residencies in primary care fields. While perhaps not at crisis level, there's still plenty of work waiting for them.
The waiting rooms are full. The visits are short. Not by the physician wanting that to be the case, but because they have such a high patient load.
While these med students believe primary care doctors deserve more money than what they earn, Jeff says those who go into the field are not in it for the salary.
People who have already made their minds up aren't going to be dissuaded because it's really for them truly a calling, which is definitely something that's very, very honorable.
There's no doubt that there's a shortage of primary care doctors. In 2009, Arizona only had 9 doctors per 10,000 people. However, John says that just like in any other occupation, the demand for more doctors will bring them to the field. Live in downtown Phoenix, I'm Liz Kodalik, Cronkite News.